Welcome to Baby Care Month 1. Congratulations on the birth of your baby. This is such an exciting time. There is a lot to get used to as you learn to care for your new baby. Feeding and caring for your baby will take up much of your day. It is important to feel prepared regarding how much and how often you feed your baby. Knowing what to expect can make you feel more confident and at ease. You may choose to feed your baby breast milk, formula, or a combination of the two. We are here to help guide you and provide information on how to confidently nourish your baby. This module will address the following topics and questions. How much and how often should my baby be eating? Is my baby eating enough? Should you wake your sleeping baby? When to start a breastfed baby on a bottle? And breastfeeding basics and troubleshooting. For more information about your health and recovery postpartum, please refer to Mom Care Month 1, Module 1. How much will my newborn baby eat? Newborn babies eat very little at each feeding and eat often throughout the course of the day and night. When babies are born, their bellies are small and are not able to hold more than approximately 20 milliliters or 0.7 ounces of fluid. That means you can expect to feed your baby approximately every hour or so in the early days of life. Newborns who are breastfeeding receive colostrum, a thick yellowish concentrated milk, on the first few days. On day 1, at each feeding, your baby may only get drops to about 5 milliliters or 1 teaspoon. Data suggests that stomach size of newborns vary, so it is important to understand that stomach capacity can vary as well. Due to these variations, stomach size does not lend well to visual representation by marble or ball models, and you cannot rely on a specific amount per hour recommendation. All babies are different. Some prefer to eat more often, and others may be able to go longer between feedings. Your baby's hunger may also vary a bit from day to day, so it is important to feed your baby on demand, not by the clock. Not having a specific number to rely on can be confusing, so coupling these estimates along with your baby's hunger signals will help you learn how to best meet your baby's needs. You will greatly rely on learning and identifying the hunger and satisfaction cues of your baby to determine when to feed and when something other than a feeding may be needed, such as a diaper change, snuggle, pacifier, etc. Keep your baby close to you and observe your baby to recognize the subtle hunger cues so you can respond and feed your baby before the demands become more obvious. Crying is a late sign of hunger. Early hunger cues include light sleep, eyes fluttering, mouth movement, hands near the mouth, and becoming alert. Your baby will become more active, turn their head or root, and start to make noise as hunger increases. More obvious and later signs of hunger are crying and becoming tense. It can be a bit more difficult to latch your baby once they are in late stages of hunger or are upset, so try to respond to the earlier hunger cues if possible for a less stressful feeding session. You will find more information regarding your baby's hunger cues in the handout titled Hunger and Fullness Cues. Your baby may not want to eat as often as every hour. If you are breastfeeding, frequent feedings help increase your milk supply and give your baby practice nursing. Expect to nurse your baby at least 8 to 12 times in a 24-hour period at minimum. It is common for a baby to nurse 15 to 20 minutes on each breast. We will discuss length of nursing sessions in more detail later in this module. As your baby grows and as his or her belly grows, they typically begin taking in more milk at each feeding session. Thus, they can naturally go a little bit longer in between feedings. Babies might only take in a half ounce per feeding for the first day or two, but over time will usually drink 1 to 2 ounces of breast milk or formula per feeding. Breastfed babies may go longer than 1 to 2 hours between feedings as their milk intake increases at the breast. Breastfed babies can also become more efficient at nursing, so may spend less time at the breast during each nursing session. After the first few days, Your formula-fed newborn will take about 2 to 3 ounces of formula per feeding and will eat every 3 to 4 hours on average. Newborn babies should breastfeed and or bottle feed on demand. As time passes and as you learn your child's needs, you can start to begin more routine-based feedings. As a general rule, your baby will drink approximately 2.5 ounces or 75 milliliters of formula per day for every pound or 453 grams of body weight. Each baby is different and can also differ day to day, but babies are often satisfied with 3 to 4 ounces or 90 to 120 milliliters per feeding during the first month of life. Please refer to the handout in this module for more information regarding breast milk and formula needs by age. How much should my baby eat? How do I know if my baby is eating enough? This is something most people question. It can be difficult to tell how much your baby is eating if you are nursing, as you can't see the milk transfer you typically would when the baby is drinking from a bottle. This often makes moms wonder and worry if their baby is getting the nutrition they need. There are a few very helpful ways to assess whether or not your baby is meeting his or her needs. First and foremost, following up with your child's pediatrician for the recommended wellness checks to assess weight gain is vital. Your baby will typically be seen for a checkup within 3 to 5 days after leaving the hospital, and again at 2 to 3 weeks of age. This may vary based on your child's doctor. Follow-up is recommended, or more often if you have concerns. Another helpful way to monitor your baby's intake is by observing output. You can keep track of the number of wet and dirty diapers your baby has each day to help determine if your baby is nursing effectively. Look for 2 to 3 wet diapers with pale or clear urine and 2 to 3 stools in the first few days. The urine should not be deep yellow or orange. The number of wet diapers will increase, and the number of dirty diapers and stooling may be approximately 3 times a day, but can vary. According to the International Lactation Consultant Association, signs of effective breastfeeding are at least 3 stools per day after day 1 and at least 6 wet diapers per day by day 4. Keep in mind, diaper output alone is not a sufficient indicator of intake and is not a substitute for weight checks. Please see the handout titled "How Much Should My Baby Eat?" for more specifics on assessing intake and number of wet and dirty diapers per day and week. As mentioned, monitoring weight gain and output are ways to assess whether your baby is eating enough, and you can also observe your baby's body language to help evaluate your baby's satisfaction with his or her meal. If your baby seems content and relaxed after eating, they are likely satisfied. Often your baby's hands may be clenched before feeding and relaxed and open after a feeding. Your baby should be alert and active when awake. Babies sleep a lot, and that is normal, but if your baby seems very lethargic or is regularly sleeping for 4 or more hours at a time, it may be a sign of low energy due to inadequate milk intake. If you are concerned, please follow up with your baby's pediatrician for a weight check and to assess baby's overall health. You will find more information regarding hunger and fullness cues in the handout titled Hunger and Fullness Cues. Do I need to wake my baby to eat? This is important to consider as sleep is extremely valuable for both you and your baby. If you are concerned that your baby is not eating enough or often enough, it may be necessary to wake him in the first few weeks of life. Whether you should wake a sleeping newborn for feedings depends on your baby's age, weight, and overall health. In the first 2 weeks, when your baby is regaining the weight lost after birth, it may be necessary to wake baby to eat if baby has slept longer than 4 hours. Once your baby has gained back the weight lost after birth, it is typically okay to wait for the baby to wake naturally. For nighttime sleep, if your baby is younger than 4 weeks old, It is a good idea to wake baby every 4 to 5 hours to nurse if they do not wake on their own. If your baby is over 4 weeks old, gaining weight appropriately, and having normal output, it is not necessary to wake your baby to eat at night. Keep in mind, your newborn will need approximately 8 to 12 feedings per day, which equates to approximately every 2 to 3 hours on average. If your baby is regularly sleeping longer stretches, it may be difficult to achieve this number of feedings. Look for early signs of hunger while baby is asleep for a good opportunity to offer a feeding. These early signs of hunger are eye fluttering, hand-to-mouth activity, smacking lips, rooting or stirring while your baby is in a light stage of sleep. Crying is a late sign of hunger, as we mentioned earlier, so if you are able to identify earlier hunger signs and feed the baby at that time, it may be more enjoyable and easier for both of you. Once you have confirmed that your baby is back up to birth weight by 1 to 2 weeks of age, it will most likely not be necessary to wake your sleeping baby for feedings. What should I do if my baby falls asleep at the breast and has been nursing for less than 15 to 20 minutes? Length of nursing sessions can be a possible indication of whether or not baby is eating enough, but cannot be the sole determination. Often babies vary in their efficiency and speed of milk removal, so it can be difficult to determine if baby has nursed for long enough just by watching the clock. Observe your baby while they nurse to look for signs of a good latch, milk transfer, and fullness cues. If your baby appears to be having difficulty getting frustrated, then falling asleep, it may be necessary to wake baby and retry. Possibly change positions, work on latch, and observe for signs of an effective milk transfer. These points will be addressed in more detail later in this module. You can also feel and observe your breast to see if you notice a difference before and after a nursing session. Your breast may feel softer after milk is expressed by baby. If you are concerned about the length of your baby's nursing sessions, for example, your baby regularly falls asleep shortly after beginning to nurse, or often takes longer than 30 to 40 minutes per feeding, they may be having difficulty transferring milk and may need some assistance. When should I start my breastfed baby on a bottle? Some moms who are breastfeeding may not find a need for introducing a bottle. If you will be working away from home or leaving baby with a caregiver for periods of time, it will likely be necessary for your baby to learn to drink from a bottle while you are away. If you want to introduce a bottle to your breastfed baby, it is best to wait 3 to 4 weeks or until breastfeeding is well established. Try to begin introducing the bottle 1 to 2 weeks prior to you returning to work or school to give baby time to learn to accept the bottle. It may take a few tries, including various types of nipples, to find what works best for your baby. There are many options regarding nipple shape and size, so choose a slow flow nipple, but feel free to experiment with different shapes or brands to find what works best for your baby. Most babies will accept a bottle, but for some, it may take time to adjust. There are some strategies that may help with your baby accepting the bottle more willingly. Timing is key. When your baby is relaxed and not too hungry, it can be a good time to offer a bottle. If your baby is too hungry or tired, they may become frustrated and upset. It can help to have someone else offer the bottle, as your baby will likely expect you to offer the breast rather than something new and different. As your breastfed baby may be less likely to accept a bottle from mom. Be mindful of how baby is held when offered a bottle. Most younger babies feed best sitting in a more upright position, supported behind their neck and shoulders with your hand or arm, or using a pillow to support them. Babies who are fed a bottle in a laid-back position may take too much milk too quickly and have difficulty managing. To encourage baby to open their mouth, gently tickle their lips with the bottle nipple. Many babies do well with a nipple that encourages them to open their mouth wide, similar to with the breast. Keep the bottle horizontal or flat. You may want just the tip of the nipple to contain milk. The whole nipple does not need to be full. This requires the baby to actively suck to get milk, which is the same as required with nursing. Choose a slow flow or newborn nipple to help keep the speed slow as well. Too much milk too quickly can lead to discomfort, eating more than needed, and frustration at the breast when baby has to work harder to get the milk. Expect baby to take 15 to 20 minutes to finish a bottle. Your baby may need a break when drinking from a bottle, as breastfeeding allows for natural pauses, so watch for signs that baby needs a break. Some signs to watch for are wrinkled forehead, wide eyes, turning head away, fingers splayed out, milk spilling from the mouth, or other indications of stress. Stop the flow or take the bottle away for a moment. If baby seems interested in continuing, that's fine. If not, they may need a break for 20 minutes or 10 minutes, or may be satisfied for the time being. If you are feeding your baby formula, please refer to the handout titled Preparing Formula for tips and information regarding formula preparation. If you are feeding your baby expressed breast milk, there is more information regarding pumping and bottle feeding in Module 2. You can also speak directly to your NutriVantage coach for guidance. Breastfeeding basics and troubleshooting. Breastfeeding is natural, but that does not necessarily mean that it will come easily. Breastfeeding is a skill that takes practice. You and your baby will both be learning during these early days. You will be learning your baby's hunger cues and what positions work best for you and your baby. Your baby will be practicing and learning how to latch and transfer milk efficiently. Some steps you can take to get breastfeeding off to a good start include lots of skin-to-skin contact after birth and in the weeks following, nursing as soon as possible after birth and on demand in the following weeks, asking for help from the lactation consultant during your hospital stay for hands-on assistance, learning to help your baby latch properly, keeping your baby nearby, sleeping safely in a bassinet or safe sleep space near you, and avoiding the use of pacifiers and bottles in the first few weeks until your baby learns to latch unless medically necessary. It is also helpful to discuss your breastfeeding plans with your partner and other family members. Let them know how they can support your breastfeeding journey. A few examples of support your partner, other family members, or visitors can provide include bringing baby to you to nurse when ready, changing baby's diaper, keeping older kids entertained so you can focus on the nursing session, helping around the house, ensure you are eating and drinking enough, helping to provide snacks or meals and water as needed, encouraging words or verbal support, and more. It can be helpful to reach out to friends or family members who have experienced breastfeeding to hear feedback and tips